Okay, so today my name is Tyler, and today we're going to be doing an NG tube insertion. I have all my supplies. I brought them into the room. I'm going to come in, going to put on a hand sanitizer, perform hand hygiene, double check my patient's name and date of birth with her wristband, and double check that against the mark. Can you tell me your name and date of birth?
Samantha Conaway, 4287.
Okay, perfect. It looks like I have the same patient. Did you know that the doctor ordered you an NG tube?
Yes, I did.
Okay, and you know what that's for. So that's good. So the patient knows, she's got a good level of consciousness. She knows why she's getting the procedure. I'm going to double check all my supplies against what has been ordered in the MAR. I'm going to verify with the patient after checking the MAR that she's had no facial trauma, no surgery, anything that I need to be aware of, anticoagulant use, things like that. Have you ever had any surgery on your nose or mouth?
No.
Okay. Any trauma to your face, nose, or mouth?
No.
Okay, perfect. So it looks like everything is good. I'm in the clear. Last thing I'm going to do is I'm going to go ahead. I'm going to auscultate bowel sounds. I'm going to double check that the doctor didn't order any kind of prokinetic that I need to administer, like metoclopramide. Doctor didn't order that. I've got my patient. She's ready. She has bowel sounds. I'm going to check her gag reflex. Okay, she's got a gag reflex. And now I'm going to get her ready. I've explained the procedure. Everything seems good. Going to give her a towel right here, and we're going to give her an emesis basin just in case you gag and need to spit anything out. Here's your emesis basin, okay? All right. What we're going to do is I'm going to insert this tube through your nose, through your nasopharynx, into your throat, and into your stomach, okay?
Yes.
All right. So I'm going to measure from her tip of her nose to her earlobe, and I'm going to mark. And then I'm going to measure that marking to her xiphoid process, and I'm going to mark right here. Okay. Now, once patient's ready, I'm going to tell her, I'm going to have you look up at first. We're going to stick this through your nose, okay, right into your nose. If you have any issue gagging or coughing or your eyes water, you need me to stop anything, raise your hand, okay?
Okay.
All right. So, and then I'm going to have you take sips. When I tell you to look down, this is going to close off your epiglottis so it doesn't go in your lungs. Okay, so I need you to sip your water through your straw when I tell you to.
Okay.
All right? Mm-hmm. If it becomes too much, raise your hand.
Okay.
Okay, so now that's all done. I'm going to go wash my hands again, and I'm going to take the tube. I'm going to lubricate it. And if there's any anesthetic, I will apply that. Okay, so my tube is lubricated like 2 to 4 inches, and we're gonna go ahead and start. Are you ready?
Yes.
Okay, look up for me. Gonna go right into her nose. I've inspected it. She's picked the correct nostril that she can breathe out of both sides, and she's picked her right nostril for insertion. So here we go. Okay, open your mouth for me. Okay, I see that it's entering the back of the throat. I'm gonna go a little further, and now I'm gonna tell her, okay, now I need you to take sips of your water, and I need you to swallow. Look down and swallow. Okay. After slow and steady movements, we've got the tube to the place. I'm going to go ahead. I'm going to take the tube to her nostril. Okay. I'm going to aspirate for gastric content and check it against the pH strip. That looks good. And now I'm going to secure it to her. I'm going to secure it to her gown with a safety pin. We're going to get an x-ray ordered to verify placement. And once that's done, if her gastric pH is under 5, in this case it's 3.5, we got it in the stomach. We're going to make sure the patient's okay. Are you comfortable?
Yes.
You think that's going to be all right for you?
Yes.
Okay. So after the x-ray comes back, I'm going to document everything. NG tube, the size that I used, the date that I put it in with the time, the nasal that I put it into, all that stuff. And if the x-ray comes back appropriate, it looks good, then we can start feeding or decompression. Thank you.